Good afternoon, everyone. I'm Kate Galvin, Health Executive for NAB. Thank you so much for joining us this afternoon for our Practitioner Community webinar. So for over 20 years, NAB has had dedicated services and expert bankers to the health sector. We're extremely proud of our specialised focus on this significant sector of the Australian economy, and never more so than in 2020. In the last 5 months alone, we've enabled card-not-present merchant payments for our overworked pharmacy customers, supported telehealth claiming via rapid changes to high caps, set up deferral and loan support packages for our practitioner customers in NAB Health and Medfin as their cash flows were interrupted like never before, and supported our aged care customers in the front line of COVID-19 outbreaks. Being a proud health banker has never been more meaningful. We hear every day at the moment about the balance between economic outcomes and health outcomes. In our hearts, we all know people are what make up our economies, and we need healthy people for healthy economic outcomes. Health bankers have always realised the importance of the work that our clients do to create a healthier Australia. We're committed to continuing to support you in this work. There have been many negative impacts from the pandemic, and my guests and I are about to discuss a lot of these. But one of the positive aspects, I believe, is that all Australians now understand the importance of a healthy and well-functioning health sector. Thank you from all of us at NAB to our health customers, particularly our practitioners, for the leadership, fortitude, professionalism and care you have shown to Australians in 2020. Now, normally, lots of you know, in August and September, I fly around the country, connecting with our NAB Health, Medfin and High Caps customers face-to-face with a nice glass of wine. Unfortunately, it's just a sparkling water this afternoon. But obviously this year it's impossible. So instead, I've tried to put together a series of webinars that I really hope provide insights and add value. We've already had one today and I've had some really good constructive feedback about that, but I look forward to hearing from you throughout this webinar. So let me tell you how it's going to run. I'm going to introduce my guests in a minute. We're going to have a chat amongst ourselves kind of for 30 or 40 minutes, depending on how interesting we are. But I'm really encouraging you to join me in the chat function. So if you look at your computer and scroll down your video pane, you'll see that there's got a question box. So if you just want to type any questions you have throughout the presentation in there, I'll make sure that at the end we have plenty of time for my guests to answer your questions. So let me introduce to you my two favourite economists. We're going to discuss the important and relevant topics of the Australian economy and our annual consumer health survey. But first, formal introductions. Alan Oster is the NAB Group Chief Economist and has for many years been responsible for NAB's global economic and financial forecasts. Usually when wine is present, which it normally is when Alan and I are travelling around the country, I talk about how he came to NAB via the Federal Treasury and a very nice stint with the OECD in Paris. Unfortunately, we can't celebrate that with a glass of wine tonight, Alan. We're also joined by Dean Pearson, who's NAB's Head of Behavioural Economics and has been analysing the Australian and global economies for over 20 years. He's recently conducted our second consumer health survey of over 1,000 Australians. We've questioned patients about their views on the Australian health system and how they found its support to them over these tumultuous times. But before we get to the detail of our survey, Alan, it's been a year like no other. How are you feeling about the Australian economy?
It's still very challenging. When we look at it, you've had a 7% fall in GDP in the June quarter. We're expecting a bit of a recovery into the September quarter, and then we've got the Melbourne lockdown, which probably means in the next, during September and December, Victoria is probably going to fall 20% in terms of GDP. So overall, we're sort of expecting the economy to sort of go sideways for to the end of the year. Then hopefully we see quite a strong rebound next year. But I think reality is that levels of unemployment are going to get up to around 10%. The fall in GDP during the course of the year is probably about 8, and even if we go back at 4.5 to 5 next year, we won't be back to normal until mid-23 in terms of the levels of GDP that we used to see. So it's going to be a long, hard slog, but rather than just tell everybody, how bad things are going to be, I think Australia has done really well in terms of managing the virus, and we've managed to not hurt ourselves as much as most of the other big economies around the world. So in a couple of years' time, I'm actually still quite optimistic. So having said all that, the reality is it's tough. And, one of the interesting things that's different to what we used to have is each week now on the Wednesday, I get to see essentially every electronic transactions that's occurred in the NAB's systems. So that's 5 million transactions a day, 2 million customers, and I see it on Wednesday for the week ending the Saturday. So we are right up to date about what's happening, and it's not great, but it's maybe not as bad as what we saw earlier in the year outside of Victoria.
And Alan, we're clearly in a recession, and you and I have been around a recession before. What's different to this recession, besides the obvious, from the recession we went through in the 90s, for example?
This is a very, very different recession. It hit very hard, very early. So I used to run the forecasting modelling area of the Treasury in the 1990s. It took us 6 months at least to realise we were in a recession. And then essentially what happened was that people initially didn't do very much about it. They tended to cut hours, and the level of unemployment essentially didn't peak until 2 years later, in November 1992. This recession hit straight away. So just to give you a feel, the all-time loss of jobs in a month was 70,000, which was basically 1992. We lost 900,000 in 2 months. Now, the government came in and spent a lot of money, JobKeeper, JobSeeker, et cetera, and so they sort of behaved. It sort of insulated the consumer a lot, helped their cash flow, helped them get through. But reality is it's still a recession. It's still going to take a lot of time to get over. The impact is just incredible. So I can show you charts where private sector demand in the 80s and the 90s very rarely ever got negative in a quarter. Now we're down 15%. All-time record fall in GDP, 2% in 1982. We've just had a 7% fall. So the intensity, the effect, the timing, it all came really quickly. You've got some tricks out there. Unemployment at present, officially it's 7.5%, but that's a lot lower than the reality. The reality is that to get unemployed in the statistician, basically you need, one, to have lost your job, and two, you need to be actively looking for work. But if you were, in some of the areas that were closed down in the middle of the year, hospitality, international travel, that sort of stuff, no one was looking for work, and no one would be looking for work in Victoria in some of the industries that are closed down. Another way we can look at it is we can say we can count every NAB customer that we can see is receiving the dole. And if we use that as our proxy, unemployment's already 10. So the impacts are there, and as we open up and people then have to start paying banks interest, the payments from JobKeeper and JobSeeker sort of slow down a bit, that's going to cause a bit of grief. The other thing that we've seen is we've had 2 lots of superannuation, and it's really different this time because we can see it, and I'm basing what we're seeing, around 55 to 60% of all the superannuation was actually sent in the shops. So it's like dropping money, and this time they spent it. Last year on the tax refunds, they hardly spent any. It all went into the banks. So it's very different. But the unfortunate bit is the damage has been done. It will take us a long time to basically get back to normal. 10% unemployment early next year, 8 the year at the end of 2021, 7 at the end of 22. To get a 5 back in it, so most of us think it's normal, unless we get a virus, a vaccine, you're not going to have a 5 in front of it for 3 to 4 years minimum. So it's got the usual effects of a recession, but it's just very different in the way it came on.
Yeah, how quickly it came. Alan, I've got 2 questions. On the superannuation front, because you see the data, I am keen to know what people actually spent the money on, because I remember last time we were talking about tax cuts and how it didn't hit retail.
Yep.
Are people buying food or are they buying tellies?
We'll put out a formal report, but basically what they're doing is they're buying about half of, 55, 60% is in retail. We thought it would be all in supermarkets and food and all that sort of stuff. It's not. It is an element there, but the big elements are basically essentially buying household goods. So if you like, doing renovations internally, selling blinds, all that sort of stuff, making up your office. So, you've got to buy a new desk, you've got to buy a new computer. While you're doing that, you may as well do some renovations. You're seeing lots in outdoor living sort of areas. So it's almost, and there was so let's say there's $300 each month extra because of the super. About 160, 170 of it was in supermarkets or in retail. About 20, 30 was basically putting in the banks. I thought they'd actually pay down their mortgages, which is not what they did. They put it into their balances. There's a few dollars here and there on online gambling, but the myth out there that online gambling is they took it all and they spent it all, that's just not true. It's sort of like a helicopter drop of money. People used it this time. So as I was saying, around 60%. This time last year, it was 12 when people got their tax refund. So very different behaviour.
Yeah. And so we talked about how it's going to be a long, slow road to recovery. Where do you see recovery, the green shoots of recovery starting, and what is that recovery going to look like kind of in specific sectors?
So we're making one heroic assumption, and that is that they're reopening the state borders by the Christmas, at the end of the year. Then we would hope that you would start, so we're out of the Victorian problem. We would hope to see the economy starting to reopen, and that will have people doing more activity and also searching for more jobs. So, we're expecting 2% plus in the March quarter, and then a couple of really strong quarters after that. But, it's really dependent on how it works. One of the things that I was saying to you earlier, and people don't understand, is that more Australians take their holidays and travel offshore than foreigners come here by a factor of 2 as a percent of GDP. So if you could get open the state borders, the travel industry and the tourism industry locally anyway would do really well, and you'd actually add to GDP. So that's really important, and our CEO will say that tomorrow in Parliament, but it is important, and so those areas I think will do well. I think people will still be cautious about where they spend their money. I really don't think a lot of businesses are going to be investing a lot, and that sort of brings us then to the budget. And I think your budget is going to be highly stimulatory. It has to be. And I know people will immediately say, but we've got too much debt. No, Australia started out in public sector debt at about 18%. The global average is about 90%. We've all spent about 10% of GDP. And when we add it up each year, you're probably going to get our debt to GDP ratios up to about 30, maybe 40%. But the rest of the world's going to be 120, 130. The paying back the debt, the interest rates are going to be really low for a really long time. So even at the end of 22, when we sort of give up on our forecast, we've got inflation less than 1.5%. So rates are not going to go up for at least 4 years, maybe more. The government might. So I see an ability for the government to boost private sector activity and also try and boost public sector. So the areas I would expect to see a lot of focus, number one, I would expect to see them bring forward personal tax cuts. So again, people might actually spend them in this environment. That's what they've done so far. I'd expect to see them trying to help small business by SME or business investments, accelerated depreciation, that sort of stuff. It doesn't actually change the level of investment overall, but it brings it forward, which is what you need. I would expect to see them doing a lot of accelerating infrastructure. So I don't want an extra airport somewhere. I want the airport that's already there accelerated. I think the idea of public housing is really good, because one of the industries that's really doing poorly at present is construction, and they're not locked down. And then finally, in the longer term, if you could actually do something that makes productivity better, so cutting down on red tape, maybe thinking about corporate tax cuts or anything that you can actually get through, I see a lot of stimulus coming, because they don't basically want to do okay and then suddenly find themselves the economy going backwards next year. That's the last thing they want.
No, totally. It'll be interesting to see what happens. When does the budget drop again?
6th of October. So it's only a few weeks away.
It's not very far away.
Maybe I think they're already talking about tax cuts. Oh, the other one
maybe you'll be able to join us. Yeah.
So basically they'll say if you paid X number of dollars last year, you can have some of up to a certain limit this year as paid for by the government.
Well,
we shall see.
Fingers crossed. Yeah, exactly. So, Alan, just bringing it back to the health sector, because we're joined by a lot of participants in that part. What do you see, as the implications for health spending or for that part of the economy from here?
Well, what we know is when they closed down initially the economy, high caps and allied health sort of died. But what we're seeing so far is that, sure, it's not doing well in Victoria at present, but it will do better. And if you get enough money into the consumers' pockets and then make them feel reasonably happy, they'll come back. At this stage, it's sort of the rest of Australia being offset by Victoria. And as you go forward, if people can think this is a little bit more normal, I think they'll always eventually, health will still be important. At present, population growth has halved. So we've gone from population growth of 1.5 to 0.7. And apparently, according to the press, the last time Australia had a 0.7 was 1917. But you go beyond that, as I said earlier, Australia looks pretty good by health standards. It looks pretty good by GDP standards. We're attached to Asia, so we're attached to India. China may be an issue, but we've got Japan, we've got Korea, we may get some more of the UK. I think a lot of people want to come and live in Australia. And I think the economy will do better than most on the way out. And so therefore, I think health will continue to play, in the long run, a really important role.
No, and it's exciting. And I think, Alan, further to your comments around people buying home offices, we've been watching, our high caps data is such a great leading indicator. And we saw a really, when the lockdowns lifted earlier in the year, we saw a great lift in that data. It was the fastest return out of lots of the sectors we look at. But a shout out to any physios that are listening to the webinar today, because actually you've been really strong all the way through. And anecdotally, we're hearing it because people are doing their backs out, sitting in bad home office chairs, Alan. So that might be something to add next time you talk about the spend there.
Yeah.
Now, Dean, I'm going to move over to you, because for the second year in a row, we've actually surveyed 1,000 general Australians about how they're finding the health sector. And I think it's a really interesting time to explore whether patients are getting from the sector what they hope to see. So can you, share with us some of the insights we've got from that survey?
Sure, Kate. I'm sitting up straighter too, because you've just reminded me about my posture. Overwhelmingly, it's COVID, of course, but it's specifically the worries people have in regards to COVID on their physical health, their emotional health, and also certainly their financial health. I mean, the financial shock is really clear in this survey. More than 1 in 6 people said they had lost their primary source of income due to COVID. Now, outside of those COVID stresses, the sorts of issues, not surprising, with things like concerns that they weren't exercising enough, weren't getting enough sleep, not spending enough time with family, too much time on technology, and their diet wasn't as good. 1 in 5 people said they had very high feelings of loneliness and isolation, and that number, of course, not surprising, was even higher in Victoria. About 1 in 5 said they needed professional help for stress or for mental health. It was about 1 in 4 in Victoria. Importantly, 4 in 10 who needed help said they'd reached out for it. We also saw some really noticeable behavioural changes. And I've got to say, quantum change takes a long time. Incremental change doesn't, but some of these behavioural changes are likely to stick. 3 in 4 people said they were keeping distance from others. In other surveys we've done, people are highly concerned about being on public transport. They're concerned about travelling on planes. Keeping distance is a real issue. Going to public centres, shopping centres, sporting events and so forth, particularly in Victoria, of course. 1 in 2 said they're covering their nose when they sneeze and when they cough. They're much more conscious about their own health and the health implications for others. 1 in 6 said they were exercising more and eating better. So that's the really good scenario. On the other hand, we can clearly see that some Australians are really falling through the cracks here. 18 to 25-year-olds said they were the most likely group that identified that they really needed professional help. Of concern, only 2 in 10 of those people said they had actually received it. 1 in 3 Australians said they were exercising less. 1 in 6 said they were eating less healthily and they were drinking more alcohol. 1 in 4 said they were getting less sleep. So all of this is compounding. On the good side, though, 1 in 5 had said that they had been COVID tested, and that was higher in Victoria. And 9 out of 10 of those people had taken that test because they either had symptoms which they identified as being of concern in regards to COVID, or they were advised to do it by a health professional. Conversely, the concern would be 8% of those in Victoria, New South Wales and the ACT did not take the test, even though they had symptoms or they were advised to do so. About 6 in 10 Australians had had a flu vaccine this year, and that was about 9 in 10 for the over 65. So there is a real mixed message in all this. Many Australians are showing incredible resilience. They're doing the right thing with their health. Others are really concerned and, are retreating a little bit and are worried about the mental health impacts and some of their behavioural changes.
So, Dean, how do you think the health systems coped during the pandemic? Well, actually, not how do you think? What do patients think?
They're remarkably positive. They think the system's coped incredibly well. Only 1 in 10 people in that survey, of 1,000 people, and this is representative of all walks of life, all income groups, all ages, said they were unable to access care during COVID. About 15% of Australians said they elected not to use the health system. That was about 1 in 5 in the ages of 25 to 34 years. When we asked them, well, what did you need most? It was GPs, dentists and prescription medicine. We're interested to ask, for those Australians who said that they had avoided the health system, why didn't they use it? And there was 3 key reasons they said. Firstly, they were just simply waiting until the restrictions were lifted. It was just too difficult to go to see somebody. Secondly, they were scared, of course, of catching COVID. They didn't want to be sitting in a waiting room and potentially catching it. Third was affordability. About 16% had had scheduled medical appointments with a specialist doctor cancelled or delayed, and that rose to about 1 in 4 for the over 65s. That's significantly lower, I've got to say, than many of the reported statistics that I've seen in the media, which are talking about numbers in the order of about 50% of cancellations. The most frequently used health advice and service over the past 3 months, not surprisingly, were in pharmacies, in GPs. They were also the 2 categories that consumers said they leaned on most heavily. In terms of satisfaction with the care that they received, we gave them a scoring system. We said out of 1 to 10, where 10 is just unbelievable, how satisfied are you? And on average, it was 8 out of 10. And that's extremely high when you consider the circumstances in which we're under. Affordability, interestingly, also scored really highly. Some Australians, though, I suspect, who didn't use the healthcare system, avoided the system because of cost. And we know that that's a little bit of a concern. We also asked, of course, about the virtual health care nature of the system. 4 in 10 Australians had experienced a non-face-to-face consultation. Now, interestingly, about half of those described that consultation as about the same as a face-to-face, but about 1 in 3 people said it was a little bit worse than usual. And when we ask them, well, what is it you value most around your interactions with a health practitioner? Really clearly this time, it is someone who explains things easily to me. And I think, there is a real issue at the moment with the complexity and the volume of information that people are being bombarded with on social media, for example. They're looking for a breakthrough understanding as to what really matters. Someone who listens, is caring, compassionate, convenient, and affordability is, there, but it's right down the list. So I think the bottom line really is, that's quite a complex picture, but certainly one of resilience on the behalf of both Australians, but also the healthcare systems itself, in the face of really significant health and financial pressures. But more importantly, the averages that we're seeing in this are masking some really important key areas of vulnerability.
Yes, so Dean, talk to us, and we ran a wellbeing and anxiety webinar earlier in the day. Talk to me about the picture you're getting of who is vulnerable in the current climate.
Yeah, well, I think it's a concern that certainly 1 in 5 Australians are saying that they are identifying with very high feelings of loneliness and isolation. I think the pandemic, of course, has particularly worsened that crisis of loneliness for people in assisted living facilities. But what this survey does show, it's a much broader issue. And I think, some of the stereotypes of ageing often point towards older adults as being, sad and lonely. But this research really shows, and other research we've done with our wellbeing research on loneliness shows it's quite the opposite in reality. It's young people who report much higher levels of loneliness. The over 65s are the least lonely, and young men in particular report very high levels of loneliness. And we know that loneliness has a lot less to do with the number of friends you have, and it has certainly more about how you feel about your friends. And young people report much more negative perceptions about their friends. It's not the number you have. Obviously, through social media, young people have got more connections than they've ever had, but the quality of those connections are certainly higher for older people. I think also it's concerning that young people are identifying that they believe they have the greatest need for professional help, yet they were the least likely to have received it of all the groups we spoke to. I think young people, and as Alan mentioned before, the economic impacts potentially are disproportionately being impacted on young Australians because of COVID-19. If we look at some of the large-scale job losses we've seen in hospitality and retail, for example, they've hit young people particularly hard. And we know that young people, when faced with an income shock, have often fewer savings to draw upon. I think more generally, it is a concern that 15% of Australians simply elected not to use the health system. For whatever reason that is, that might certainly have some quite serious health implications for their health in the longer term.
It's really interesting, isn't it? Because there are aspects of the pandemic that have really accelerated innovation and change. And I'm interested to know from each of you, and Alan, I might come back to you on this, where have you seen in parts of the economy kind of the greatest innovation and acceleration of change that you think is going to have an impact longer term?
Well, I think one of the things that surprised me is how innovative people like restaurants were. Now, okay, they're under a lot of trouble, but they're still serving takeaways. Some of them that I've talked to say they're going to keep doing this. Also, even though it's not really working at present, real estate agents did lots of innovative stuff in terms of how you have an auction online, and I think that will continue. I suspect there's been a lot of innovation in relation to things on the internet and how you do extra stuff, but in particular, where things were really under stress, there's been a huge amount of innovation, and going forward, I suspect we're going to see a lot more manufacturing in areas like medical. Would you now rely on China to provide all your vaccines, etc. now? And I think the answer is no, and that's global. So I think you're going to see more of that. There'd be pressures elsewhere, such as house prices and commercial property and all that sort of stuff. But I think the innovation has been quite impressive. If nothing else, Kate, to make you feel a little bit happier, where I live in Melbourne, I can get takeaway, and I can get takeaway from a restaurant called Attica. And for people that don't know Attica,
nice. Yeah. It's
number 40 in the world. And I could get for $200. I went there about 12 months ago. It cost me $1,000 for 2. Ben Sherry, who's the chef, delivered it personally. So
it's awesome. I would ask those of us on the webinar who are joining us from other states. I'm sure you have great sympathy and understanding for Victorians, where we have to look. We're really trying to be glass half full at the moment, aren't we, Alan? And I suppose on that note, there's a lot of eating from nice restaurants and getting them delivered to your door. But I am interested, Alan, from a retail perspective. As someone who's been locked down for a long time, I've had to stop the online shopping a little bit. But anecdotally, we're hearing that the impact of these lockdowns and the pandemic on retail actually hasn't been as adverse in some parts of the sector as you might think.
Well, yeah, and so one thing, just a statistic to think about, people say it's amazing that retail's up 10% on this time last year. Online retail is up 73%. So I think that's a trend that's going to continue. People are now had to do it. They've sort of said, well, I'm going to do that. The other area that we see very strong growth is in pharmacies, where people will go to the pharmacy. Okay, you might not be able to, in Victoria, you can't actually go in, but you can still buy your stuff. And so I sort of see this change, and I worry that parts of retail will suffer when income gets withdrawn from the government, and that's why I think the budget is really important. But the negative parts of retail at present, the two big ones are number one, clothing, footwear, that sort of stuff, and number two, fuel retailing, by which they mean you're not going as much in your car, and therefore you're not buying as much petrol. And secondly, if you're not going to the petrol station, you're not buying the stuff that you can pick up at the sort of convenience stores attached to petrol stations.
No, that makes sense. I filled up my car, I think, once in the last 12 weeks. So I can see that how fuel retailers would be hurting. Dean, you touched a little bit on telehealth and the responses that we'd had in the survey. What other kind of changes or innovations do you see happening more broadly?
It's an interesting one, and I think the non-face-to-face interaction is really important, because I think what it does is, and I think there are definitely parallels here with online retail, in that you're exposing really big percentages of the population to a type of technology or a type of innovation that perhaps they would have been reluctant to use previously. And we know with online retail that many older Australians who never would have purchased online historically are actually now doing it and finding it's not such a prohibitive or difficult thing to do. So I think there's an enormous opportunity to start engaging with people in different ways, particularly in healthcare. And while many were satisfied, we've got 1 in 3 Australians who were not quite so satisfied. I think this notion of a hybrid model where the physical premises is really critically important, and we're going to talk to pharmacists later on, and some of the feedback that we get around the human interaction and how health practitioners are providing services well over and above what is considered to be a reasonable community standard of that I think is beginning to become even more important. So I think hopefully the innovation that we're seeing is going to take some pressure off the system, so that those people who really do need face-to-face interactions can actually find the time and the opportunity to see a health practitioner, whereas those that perhaps don't need that, we can actually rely on the innovation of the sector. And we put out an innovation index every year, Kate, and we put one out about 2 months ago, and it asks about doing things differently, more quickly and more cost effectively. And not surprisingly, it collapsed in terms of cost effectively and more quickly, but differently went through the roof. And it went through the roof in the very areas, necessity is the mother of invention here. So as Alan said, it went up a lot in retail, in hospitality, industries that are having to pivot. So I think this is a unique opportunity for businesses to test really different ways of engaging with customers and patients because of the challenges of COVID.
No, I couldn't agree more. And it would be remiss of me to have my 2 favourite economists, and I watch the news every night, and we hear our politicians talking about how do we balance health outcomes with economic outcomes. And I know it's a really difficult kind of thing to have a view on, but I'm really for you to hear your thoughts on how we're doing that and how we might think about doing it in the future. Maybe I'll start with you, Alan.
So you're breaking up a little bit, but I think, yeah. I think basically what we're expecting to see is further innovation. We're expecting to see changes in the way people work, which will have negative impacts if you're in the CBD. I think innovation, as we talked about, will actually help a lot. And I see as we get out the other side of the pandemic, that the economy, Australia will do really well. And I think the innovation that, you have to do this to survive is really important. And the way they do things differently, and they'll continue to do things differently, and they may have hit on new methodologies of working. And so I think that's really important as we go forward. So again, I'm pretty optimistic about it.
It's very nice to see you optimistic, Alan, because that isn't always the case when we sit down and talk about the economy. Dean,
can I also say that? Yeah, I was going to say, I also think Australia has done really well in the health system. We have traded off essentially weakness in GDP that looks horrendous compared to historical, but it's much better than what some of the other countries done. So I'll just use some numbers to think about. So Australian GDP in the June quarter fell 7%. In the UK, they were really pleased. It was only 9%. In Europe, it fell 12%. And in the UK, it fell 20% in the quarter. And in New Zealand next week, we're probably going to find they're really happy. They're only falling 13%. They were worried they're going to fall 20%. So I think we've done a pretty good job in the balance in this.
Yeah, that's awesome. Thank you. Dean, do you have a view on, how, as a behavioural economist, how do we balance the health and economic outcomes?
I think it's impossible to differentiate the two, and I think that's what's really important about what the pandemic has actually done. We know that health inequality will fall greatly as a nation gets richer. Now, the US is a bit of the exception there. But I remember Alan got a question last year, which was basically, why do we need economic growth? And his answer is the right answer for today more than ever, which is it creates jobs. And we know that the most exposed people in this crisis are the unemployed, but also the disabled, the less qualified. And their position gets worse as downturns deteriorate. So our jobs are so fundamentally important to us, not just financially, but also psychologically, in terms of supporting our sense of control and balance. So I think, we've seen how important it is to support the most vulnerable people. And if you look at some of the big democracies across the world, if someone had have told you that, and they haven't certainly done it as effectively, I think, as we have, that the US would be supporting people in the way they are, particularly under Trump, you would find that remarkable. And I think the other thing, and I read a statistic the other day, and I don't know if this is true, that something in the order of 40% of PPE, 40% of face masks, and a whole range of other really key equipment are produced by 3 countries, the US, Germany, and China. So I think the economic crisis and the health crisis are one in the same. And I think eventually we're finally on a page where we're talking about them together, not as 2 trade-offs.
No, I couldn't agree more, Dean, thank you. So just a reminder, that's enough questioning for me, and a webinar is always more interesting when we have people joining us and asking some questions. So if you could just scroll down to under your video frame and enter any questions you've got in the I've got a question box. I've had a couple come through already, but just while you're putting your questions, I'd like to share with you, we started a campaign where we're featuring some customer stories. 30 seconds to have a look at our first customer story. We have a great one for practitioners, but these have been very challenging, particularly with the Victorian lockdowns. But I'd invite you just to have a look at Perry McCarthy, our great customer from Pharmacy Neo, and her customer story.
What gets me up in the morning? I love what I do. I've always been a bit of a risk taker. I get a adrenaline rush from taking on new projects. I'll never stand still. My business banker has helped me in both my personal and my business banking over the last 13 years. He knows me very well now and he knows what makes me tick. He's always got my back.
NAB, more than money.
Thank you. I hope you enjoyed that. I've got a great question here, which I'm interested to hear both Alan and Dean's view on, which is, how do you see the role of practitioners evolving beyond this pandemic? You know, an example being facing into increasing mental health issues faced by young Australians. So, Dean, I know we've had a long discussion about that in the middle of the day today, but how do you see particularly the role of practitioners evolving from here?
I think, you know, it's similar to the last question that was raised as well. This pandemic, you know, and Alan can talk to the financial shocks really well, but I think what we're seeing is that there's an enormous amount of stabilisers that are in place at the moment, such as JobKeeper and people being able to pull their superannuation out, mortgage, you know, delays in repayments and so forth. At some point, when that rolls off, we'll be facing into an economic crisis, but also definitely a mental health crisis. And as we, you know, spoke today, Kate, around the mental health issue that's coming, that what it has done is brought to the fore just how important it is to have that conversation. And of course, you know, frontline medical practitioners are the ones that will be facing into that. So my hope is, and you know, this was many of the issues that were raised last year when we went around Australia, was all around mental health. It was all around young people's mental health in particular. And we do know that, you know, through all our surveys and all our research on wellbeing, that it is young Australians who, in particular, young women, but also young men in terms of identifying loneliness as an issue for them, are really facing into these problems. So I think now more than ever, we have to support our frontline health practitioners. And, you know, we're going to talk about some research a bit later on too, Kate, about harassment of frontline medical practitioners and health workers. And that's up substantially. So I think we have to look after the wellbeing of our population. We have to support our health workers more than ever, and hopefully what COVID's done is elevate their importance in the economy. But we also need to take some time to support the health practitioners' mental health themselves as well.
Thank you. And Alan, do you have a view on how the role of practitioners might change from here?
I'm pretty much the same as Dean. I think one of the problems with high levels of unemployment and you know, people feeling really stressed is their mental health's going to be in trouble, and they need to talk to people, talk it out. They're not alone. And a lot of my friends, and I said even at work colleagues, they're feeling, particularly in Victoria, more depressed than they were during the first lockdown. In the first one, I said, yeah, okay, you know, we're all in it together, blah, blah, blah. And now we sit around and we're seeing football and all that sort of thing happening, and people going out. And you sit in Melbourne, you think, and so that's an issue. High levels of unemployment. It's going to look really hard if you're trying to run a small business in some of these areas. And, you know, I think people need to talk to people. They need to get good intelligence if they're sick. That, you know, people will die from other things rather than just the virus. And, you know, I think a lot of the issues associated is you need a really good health system to support. And some people say, and I think it's true, New Zealand shut down and tried to eliminate the thing because they didn't have a good health system. They didn't have that many health intensive care beds. And so they had to do that. We've got that. So I see health as really important, and I particularly see mental health, psychology, all that sort of stuff as likely to be important. And, you know, you can go and talk to your chemist, your doctor, etc., and then try and put that all together, go and see, get some mental health if you can. And I agree with Dean. The problem is very much youth unemployment is terrible, and the number of people that are essentially either unemployed, not working because they no point, or are working less hours. It's around 20% of the population that have got that, and so I see mental health as really important as we go forward.
Yeah, it was interesting today. We ran at lunchtime. We had a webinar on wellbeing and anxiety. We had Susan Ferrier, who runs our people function at NAB, looking after our 35,000 colleagues. And I thought one of the most interesting points she made about mental health and wellbeing is it stopped being a occupational health and safety issue, and it's actually become a core tenet of something you need to fix to be able to move, to be able to do business. And it's become more than just a side conversation, something to tick. It's actually an important thing that large businesses and small businesses are going to have to step into, rather than just ticking a box to say, yes, we've got it covered off in the future. I think it'll be very interesting. Now, gentlemen, we're really going to earn our right to be on the webinar with a great question I've got coming out of Queensland. How do you feel about private health insurance and health funds moving forward?
That's difficult because at present, I've talked to a couple of the big ones. They're slightly nervous about the fact that they're offering essentially insurance, and that people are not going to the hospitals because they're fearful that they're going to essentially catch something.
Yeah.
And so what I understand, as when we talk to these guys, and I've talked to a couple of boards of large insurers, that they're doing very well at present, but they're really worried about the long term, that this is one, it could catch the eyes of regulators, something about fees for no service, which banking knows all about. And I think it might be more difficult if people decide, okay, my income is now suffering. I'm not getting JobKeeper and I'm not getting the dole as much. And even if I'm getting it, it's not paying me as much. I might just opt out. And that's, I think, the number one fear for health funds. At present, they're doing great. But in the long term, you know, you can opt out and then they just might not come back.
Yeah, it's interesting, isn't it, Alan? I have cause to think about this quite a bit because we look after a lot of private hospitals. And at the moment, you know, with elective surgeries being pushed out, particularly in Victoria, or postponed, there is a big backlog. So there is also that balance between, you know, eventually over time, if you put off an elective surgery, it becomes non-elective and essential. And there is a bit of a feeling amongst practitioners and hospitals that there'll be a big wave of activity that the public system won't be able to cope with. And you might see an increase in private insurance as people need to access the private system to get things done fast. So some of the anecdotal stuff we're hearing is there could be longer wait times once everything is relatively back to normal, because we're going to have a really big backlog. I had this really hopeful conversation with Dean a couple of months ago where I said, finally, everyone's talking about the importance of health and the health system, and people are going to start investing in their health outcomes. It's going to be positive for our health insurance customers. And Dean, can you remember what you told me people were actually spending their money on in lockdown?
It was probably alcohol and gambling at the time, but
yes, it was. It was. At least now we know they're spending
on
home renovations.
Yeah. Well, actually, I mean, we do large consumer panel surveys every quarter, and I've got to say, you know, we do ask people, where do you think you are going to spend less, and where you're going to spend more? And people say, I'm going to spend a lot more money on essentials. I'm spending much more money on my utility bills, much less money on transport because I don't have to go to travel to work anymore. But where I'm going to particularly cut back is private health insurance and private school fees. But we've, in part of that, 1,000 consumer panel we've just done on the healthcare system, we did ask about health insurance, and what it appeared, at least aspirationally, people were saying, I'm going to spend less, but if I can, I won't fully opt out of the system. So that's encouraging. But I also know that, I have glaucoma, so I have to regularly go and see an eye doctor. And when I went to see my eye specialist, his concern was, we're open for business and so many people have cancelled. We're not cancelling them, but people have cancelled their checkups. And long term, that's a really dangerous scenario for people that have serious conditions.
No, I think that's a really good lead indeed. I've got a great question here from Raj, which is, what does your data say about many medical practices at the risk of closure because of the increased cost of compliance with COVID and ongoing reluctance of patients to visit or access the non-critical care they need? So I can talk about that from the conversations I have with my bankers, and also from the information I get from my colleagues at Medfin in particular, because there we were dealing with a lot of practitioners who had their cash flows interrupted really quickly. What we're seeing particularly in that practitioner part of the market where you may have one or two clinics, is those that are innovating, and we touched on this earlier in the conversation, those that are adopting telehealth, or those that are getting on the front foot and booking in patients, calling patients rather than waiting for patients to call them, are actually having a good chance of maintaining their revenues and their cash flows. So it's a matter of thinking about your business proactively rather than just doing it the way you've done it before. And we're actually seeing quite a few of our clients improving their profitability and cash flows just by thinking about how do they run their practices a little bit differently. But I'm wondering whether Dean or Alan, you've seen any data that may support or disprove those anecdotal theories.
I can talk in the general sense, but not in the health sense. We worry there's a lot of firms who are basically surviving because they're shut down. They might then try and open around Christmas or whenever they can open. Christmas is unlikely to be as strong as what they'd hoped. And so we're a fair bit of concern that there might be some issues about bankruptcies early in the new year. And the most depressing thing I did recently was a very major Zoom meeting with insolvency guys. And their sort of response about how's the world going, their answer is they've got no business at present. Just wait to January, February next year, and then we'll be so busy it won't be funny. So I'm hoping they're wrong, but that's what they're thinking.
And Dean, any insights you can share around, or at the moment patients are feeling they've got access to the care they need. Did any of them have concerns that might not be the case moving forward?
I think overwhelmingly most people felt, to get an 8 out of 10 score in terms of quality of care in this environment is amazing. And yes, you're right, access wasn't a problem for the vast majority of Australians, but for about 15% or so it was. And it was that issue of affordability. And I think, we're talking about the mental health issues that are facing into medical practitioners going forward. And, the thing that I took away from today listening to Beyond Blue was the importance of listening. And I think that really says that doctors need time to spend with people because people are going to want to actually talk about their issues. And are they remunerated for that time? So are we looking after doctors in that sense so they can actually spend the sorts of time that is going to be required to help people going forward? So, there was an anecdote in some of the surveys there that one practice, as you said, Kate, proactive, wrote out to 200 of their patients, asking about their care, saying we're here for you, how can we help you? So I think that is certainly part of the story.
Yeah, definitely. Now, I can't believe we've got this far into this conversation without a question about real estate. So, Alan, how do you feel about the next 12 months, particularly with regards, so thank you, Nathan, for this question, to commercial property and its forecast and CBD areas?
I'll talk about the good one first, residential property. Residential property, three things matter: interest rates, which are going nowhere, population, which is also halving, and unemployment. And in the past, anything above 8% unemployment would cause a lot of grief. So we and the bank's not trying to actively kick you out, but they would like you to start repaying some of the interest. So we would say that in the capital cities, you're basically going to see 15% fall, 12 to 15. So keep thinking about another 12 months of -1 each month. In some of the areas where population growth isn't that affected, so this is in some of the regional areas of Australia, they're actually doing better. And Zoom is actually going to be one of the big issues there, because if you're in, say, Sydney, then you're happy to work from the Blue Mountains, Melbourne, Geelong, Ballarat, Bendigo. So you're going to get different effects in different regions. I think you're also going to find that people are not going to pay the premium that they used to pay to be close to the CBD if they're working from home. So gravity just says to me probably 10 to 15% down from here. And, that's not a big issue to me because, we've been 10 to 15% down recently, got back up, now we're going back down again. The commercial property one, I think, is more of a problem. It's going to depend on how many people go back into particularly the CBDs of Sydney and Melbourne, where, if they're not going to go back into large numbers, and at this stage only about 10% are going back, I don't think you're going to get a lot more than that. I don't think you're going to get north of 50 going forward. And so that means you've already overbuilt in terms of essentially the office market and also retail. So if anyone's in small business in a CBD, essentially catering for the office workers, you've got a problem. And we think, okay, you'll get less people into a office than you used to, but I think there's going to be big issues about the value of those commercial property. So our sort of base case assumes, 15% down each year for the next couple of years. And so that's a big issue. So that's the negative side, I think. Positive side is, the sort of other things, internet, innovation, health to some extent, and opportunities for essentially population growth. But in the near term, I can't really see why you've not oversupplied. And I don't think it's interesting when we ask people why you don't want to come back, a lot of it is not that I don't trust the office. It's just that I do not trust the public transport system. And so therefore,
Do you think though?
As long as you don't have problems in your internet connections, it's going to be a pretty fundamental shift.
Yeah. Alan, do you think that it's interesting though, if a miracle happens and there's a vaccine tomorrow, do we all go back to normal, or do you think that we still have challenges when it comes to CBDs and commercial real estate?
I think a vaccine would help a lot, really would. I don't know whether, I'm not going to talk to the health professionals about how close the vaccine is, but, I suspect you need to do it a couple of times. We'll do it each year. It's like a flu vaccination. And if it gets 60 to 80%, I'd be really happy. But I still think a lot of people will change the way they work. They've got their office set up at home now, and as long as the businesses are prepared to continue to say that you can work from home, you've got to have the internet there, by the way. But as long as then that's still a problem.
Yeah, no, thank you. Hey, I've got one quick question. John from WA is asking, what's your take on the WA economy? In 30 seconds, Alan, so I can close this on time.
It's by far the best of any place in Australia at present. They're really strong numbers. And I think it's part of it is the story that you're sufficiently away that border closures don't really hurt that much. Mining's doing pretty well. Iron ore price is still really high. So of all the economies around Australia at present, Western Australia is doing by far the best.
Oh, having been to Western Australia with Alan for the last 3 years, that is a fantastic note on which to draw to a close this webinar, because that is not the kind of thing that we would have been saying about the Western Australian economy over quite a few years over the past. So thank you, Alan. And thank you so much, John, for that question. It's really interesting, isn't it? Because I think you're right, Alan. I think there's going to be a lot of change in the way we work. But I'm really hoping that there isn't a change in the way that we connect and that we can still continue to have connection. I would have loved to have been all around the country this month, meeting people face to face. It is probably the thing, particularly us Victorians, miss the most, is that human connection. And I imagine that we will all work differently in the future, but there is never ever a replacement for standing together and talking about important issues like our economy. So I think my other takeaway would be, as soon as we can, we need to get these borders open and all go on holidays and spend like we're in Europe. So fingers crossed that will happen. I only have 2 thank yous to say, really. Well, actually 3. First, thank you so much to Dean and Alan for taking time to share your thoughts and opinions and views with our wonderful health practitioners. But of course, a very heartfelt thank you to all of you who've taken the time to listen or join us on this webinar. And thank you very much for being great and supportive clients of NAB Health. We have been proud, so proud, and happy to support you in 2020 and look forward to doing so for many years to come. Thank you, everyone.